Decoded, The Future of Health, hosted by Dr. Vinod Gauba and Alex Kummerman. Today's special guest is Shaikha Almazrouei, head of the UAE Stem Cell Society, instrumental in the Emirati Genome Project, discussing tailoring healthcare towards individualized care.
It's with great pleasure that we welcome Dr. Shaikha Almazrouei, who is not only a very accomplished stem cell and genomics researcher, she also heads the UAE Stem Cell Society and was instrumental in the Emirati Genome Project and is actually pioneering trailblazer, I would say, in the domains of genomics and regenerative medicine in the UAE. Welcome very much to the show.
Thank you, Vinod. Thank you for having me. And it's a pleasure to speak about my humble experience in the genome and regenerative medicine in the UAE.
Thank you so much. And it would be wonderful to hear a little bit about what brought you to this point in your life and to have this passion that you have clearly for the space of regenerative medicine and genomics.
So actually, I started my education by looking to understand more about the DNA. Because the era when I grew up, the DNA was something new to the field in the UAE. And I was lucky that the UAE University in Al Ain, they have opened a branch of the biology department called Cellular and Molecular Biology. And that division focused mainly on how cellular function and what is the DNA and the molecular level of the DNA and genomics. And I followed that bachelor program with a more precise field of genomics, focusing also on a very hot topic in the region, not only in the UAE, the familial hypercholesteremia, how our genes affect our level of cholesterol in our blood. So that was really a very interesting topic for me to help me to understand how our body functions on a genomic level and what is the DNA actually. It was very enlightening for me to understand all this question was in my mind.
Oh, beautiful. Yeah.
Yes.
Thank you for sharing. And in this journey of passion, what was the drive? What was pulling you to learn more?
Actually, I was reading an article about the DNA fingerprint and how we can be identified by our DNA. And that was a big question for me. How can our DNA help us to know who we are? And with reading more about it, I really wanted to study this field to understand how understanding the DNA will really help us to improve our health, prevent a lot of diseases. That was a passion for me, actually. And then coincidentally, actually, we had a very sad story in our family. One of my brother got acute lymphocytic leukemia, which was a type of blood cancer, happened due to a mutation on his genes, and that was really driven me to understand how our genes affect our health. And he started taking all these chemotherapies, and he completed 2 cycles, and after 2 years he got a recurrent, and then we found that the chemo was not the solution. And then he got a second recurrent, and at that point I was searching what could be the solution for his condition, and I found that the stem cells could be the solution for his condition. And with the bone marrow transplant based on the stem cell acquired from the bone marrow aspirate from the donors, we could have solved his condition by having my brother Abdullah give him the bone marrow, and the stem cell saved his life.
Alhamdulillah, he's better now. Wow, what a wonderful success story.
Yeah.
And I can see how that could inspire you to wake up in the morning and want to go to work. You know?
We loved Rashid so much. He's the funniest person in the family. And we really did not want to lose him. We were really about to lose him.
Of course.
But alhamdulillah, stem cell saved his life.
Fantastic. And then, I mean, that I'm sure was a big part of the inspiration,
of course.
Even for the Emirati Genome Project, because once you had that success at home, you want to share it with everyone.
True.
And then the DNA fingerprinting. And can you talk us through those projects and how you feel they have and will continue to impact society in the UAE and potentially beyond?
Of course. Well, understanding the genomic makeup will definitely allow us to understand deeply how our body functions. What is the condition of our genomes? Do we have mutations? Do we have deletions? Do we have a mutation that we inherited it from our ancestors? Or did it happen due to environmental factor, our lifestyle practice? We can have some de novo mutation that we did not took from our parents. So understanding the genome makeup will really help us to understand how our body function, what is the chance for us to inherit disease or to have some kind of diseases, how we can take preventable actions to stop these diseases happening. And another new field of the genome came, which are called the epigenome. The epigenome is nothing but understanding how the environmental factor will affect the health of our DNA. Our DNA is very smart in a way that it will protect itself from anything that could break it down by having some small molecule called methyl group to close it so nothing can break these sides. And that kind of DNA methylation process, we call DNA methylation process, will allow us to understand how healthy is the body in terms of his DNA. If we are getting a lot of access to free radicals, not sleeping enough, stress, not eating healthy food, all that will definitely affect our DNA, and our DNA would close itself by adding those methyl groups. So I could have the correct code of my gene, but because my DNA is over protective due to all the environmental factors, it will close the gene and the gene will no longer be active. Although I have no mutation, and that's how this will affect my function. So when we talk about the DNA, we talk about the code of life. The code of life starts from our DNA. The DNA will be transcribed to an mRNA, and then that mRNA will be translated to a protein. So the functional form of our body is the protein that comes from the DNA. So if I have the correct code, I will have the correct protein that will do the function I need in my body. However, I could have the correct code, but because of my lifestyle is not healthy, the code could be not active, so I don't have the protein that I need in my body. I can give an example, a very easy example on it. In case if I am a person who is a smoker, a person who does not eat healthy food, does not exercise enough, does not or have some stress in the body due to work, financial, or any kind of stress, emotional, whatever, those 5 or 6 elements will really affect our health, and our DNA could be damaged due to these factors. Our example that simply I gave to, if we can really correct this, if it's possible to correct these things by changing our lifestyle or not, it is yes. The answer is yes, because we always hear that longevity is reverting back the age by 20 years old, and people are always asking, is it true, and how that can be done. The simple example I always give is the plant. Take a plant, leave it into the rush environment and the sun, don't give it water, it will die, definitely. And the same will happen to our body. If I take care of my body, I will definitely have my body live healthier for a longer period. And this is the goal of the longevity program, is to give ourselves to live a longer lifespan, but healthier lifespan, where my body can function healthy with the way I want to live younger.
Absolutely. Fantastic. Thank you so much for sharing that. And, obviously understanding then when you sequence the genome, you've applied the genome-wide association study findings, you get polygenic risk scores, you can risk stratify these chronic diseases.
Of course.
But then when you come into implementing that at the population level, how can you create a tangible impact by translating this knowledge into actionable insights and truly lifestyle modification that people will feel accountable to do? Because this is, I think, where
Yes.
On a population level, I see a bit of a challenge.
It is really very important, and that's what we call population genomic. The genome-wide genome studies showed that population have different type or polymorphism between the human beings. So the genes of the European people might not be the same of the Asian and Caucasian and the Arab. So having understanding all the genomic makeup by utilizing the cutting-edge research tools and utilizing the AI tools and reading the genome, it was very much helpful for us to understand how the different genomic makeup will be affecting not only our health, but how our body will metabolize the medicine. We always try to make the effectiveness of those medication we are having, and we need to make sure that those medication we are having will definitely give us the purpose of taking it. I don't want to take a medicine that doesn't work on me. So by understanding our genomic makeup on a population level will definitely allow us to understand how we can tailor those medication based on our genomic makeup. Not every medication, I could be living in a place where I am an Emirati, having the same medication with my colleague who is European. Our genomic makeup is absolutely different. We have some similarities, but we have also some differences. He might get the effectiveness of that medication, while I might not have the possibility due to my polymorphism on my gene to digest or metabolize that kind of medication. So it's really important for us to understand on a population level how our genomic makeup will really help us to tailor the medication and to also build a protective program from health perspective for a healthier population. It's very important.
Can I just segue on that? Is that if innovative molecules are being discovered, new therapeutic agents are being found in other parts of the world.
Yes.
At the end of the day, you want them to be taking into account the Emirati genome when they're evolving and developing that molecule. Now, how is that possible if the Emirati Genome Project and the data is sitting here rather than being shared? Now, that leads into also the concept of federation and what's your thoughts on the federation of data? And do you feel that that's the way forward to truly help not only globally, but also your own population?
Of course. As you said, the genomic makeup of the Arab population was very limited on the GY studies. And having the UAE Genome Program, and then we have also the Qatar Genome, we have the Saudi Genome, this will definitely play a very crucial role on understanding the genomic makeup of the region and will definitely play a good impact on how our genome will definitely add a value on understanding the whole human genome makeup. With utilizing the cutting-edge tools at the UAE Genome Program, we have utilized the long-read technologies, we have done the short reads. The facility of the omics built at M42 was the only facility in the world that combined the three technologies from China, UK, and US to utilize all these tools to really understand the whole genome of the UAE population, taking it a sequence from telomere to telomere, and that is a really high depth into our genomic makeup that will reveal a lot of unknown information about the Arab population. And the good thing that the population size of UAE is really diverse within the region, and that will really help us not only to understand the genomic makeup of the UAE, but the near region as well, because we have cousins from Oman, from Yemen, from the northern Arab countries, and that will definitely help us to understand the Arabic genomic makeup. and to reveal all the unknown question about how those information will really help us to tailor medications and to put some preventive, because our genes will tell us what we are carrying, what is the susceptibility of the people in this region for different type of diseases, cardiovascular, brain diseases, any kind of cancers, or how can we treat also these diseases? Is it due to mutation? Is it due to epigenetics? This is really important for us to know about it.
Thank you for sharing. This is fascinating. So can you give us a bit more about your vision for the future and how, the future of gene therapy in the UAE, and how do you see yourself contributing to this?
Well, to be honest, understanding the genomic makeup is one element of the whole health.
Mm-hmm.
The good thing about the UAE that they build a very strong infrastructure for the healthcare. We have one of the good health insurance system in the world. We have good quality of healthcare service. The quality of the hospitals and the healthcare facility, let's say one of the top in the world, and the quality of the care system is also important. Combining this with the genomic and the clinical data will really help us to tailor the healthcare service toward the individualized people. Again, I could suffer from a condition that my friend could suffer from it and other people could suffer from it, but the cause of it, why it happens to me, could not be the same. And that's how we can combine all this data, and data is really important. Combining the clinical data with the genomic data will really help us to tailor all these healthcare services for the UAE.
And I definitely agree that the multi-omic approach and looking at the phenomics, the clinical pathological correlations.
Yes.
But just, Shaikha, if you allow me to probe a little further on this point of data that you mentioned. Because the one of the challenges we see in the world is that currently projects like the UAE Genome Project, they have very rich data sets, whether it's genetic or multi-omic, but they tend to still stay fairly siloed. And the reason is, of course, we understand the reasons, but coming back to what you mentioned earlier, that partnering with, Qatar, with Saudi, eventually working with other companies and countries that are developing new therapeutic molecules, how can this information work collectively, and how can it actually influence that molecule being developed, for example, in Basel, Switzerland, unless we're able to effectively share and collaborate safely with that information? What are your thoughts on that?
Exactly. You said it, safety of data. I think now we in the UAE are very much focused on how to protect this data and allow only those who will definitely make a good use of this data, especially the researchers who are working on different type of research that will allow them to utilize this data on their research and to analyze the data, especially the bioinformaticians. Well, all this data will not be definitely helpful unless we allow the access to it. But I think the UAE now is in a very much good stage of allowing the access to it, and the Department of Health is now putting all the policies and the regulation on allowing the access for the researchers who are working on the research for the UAE population to share it internationally. I think this is in their milestones, and I think the Department of Health will definitely announce about all this soon. But sure, we need to share all this data, but again, we need to make sure that we are protecting this data, because this could be another source of
Absolutely. Abuse and mismanagement.
Exactly.
And I think it's that security and that trust that needs to be built.
Exactly.
But effectively, it's what the scientific community needs, and that's what the population needs. So that rather than necessarily just tailoring the dose of the beta blocker, for example, with Muhammad who has hypertension, we can actually produce a molecule that he would respond to better.
Yeah, exactly.
And this goes into precision medicine and personalized medicine. So it's very exciting. Thank you.
Exactly.
No, fascinating. Thank you very much for sharing this wealth of expertise in the domain. I think it's really remarkable.
A few, Dr. Sheikh, I was going to ask you for some key takeaways that people should look out for or be aware of what's coming on the horizon, whether it's for UAE, whether it's the UAE Genomic Project, whether it's stem cell or stem cell applications, clinical applications of stem cell therapies, because that's another perceived as gray area currently.
Yes.
Please give us a few takeaway points on that.
Thank you very much on asking me this question. I really like such kind of a question because it has a broad perspective. When we talk about stem cell therapies, longevity, and all these aspects, I don't believe anyone who will come to say to me, come to my place, I will give you the injection that will take you back 20 years. No, it's not the way it works, honestly. No. Well, having that said, in order for us to have a healthy life for a longer period or increase the lifespan, the healthier lifespan, we need to combine at least 8 elements. That will include, of course, all the testing, the correct testing. If we do a correct diagnosis, then we can give a correct intervention. So having all the testing required for my regular body checkup is really important. Then maintaining a healthy lifestyle, the food that I'm eating. There is something we call it nutrigenomics. I need to understand what is the good food for my body, not what is the good food I like to eat. So I need to give my body the food that it can digest and metabolize in a good way. I need to understand the genomic makeup, how my genes are protective, are healthy, and what is the mutation that I'm carrying, what is my susceptibility for all these diseases, and can I prevent them or delay them? This is very important. And then emotional and stress is really important. Sleep is very important. Our body are built to work in the day and sleep at the night. If I do the opposite, it won't work, because there are a lot of hormones and a lot of function that happens during our sleep, on the dark sleep, not the day sleep, that my body needs. So sleep is an element. And then, of course, the regenerative part of it. Does the stem cell help to rejuvenate our body? The answer is yes. But we need to make sure that those cellular therapies are considered as a drug. It has to show its efficacy and safety through all the clinical trials. Because a lot of people are traveling now worldwide seeking for all these injections, and they think that injection will do the magic. The injection itself will not do the magic, especially if someone has a chronic disease that will require a lifestyle management, some intervention, and maybe sometimes some rehab. So all these elements together will assure you that you will really rejuvenate and have a healthier life for a longer period, but not an injection only or a pill only itself.
Absolutely. So if I understand correctly, stem cells clearly have a role to play.
One role of it.
But
not all
it doesn't beat the lifestyle modifications that genomics and epigenomics and phenomics can give you great insights into. I sort of see it as building, it's like the fertile soil that you grow on.
Exactly.
And then you can go in with stem cells and prune and tweak and refine and optimize. But effectively, you need the base foundation to be strong.
Exactly.
Yeah, fantastic. Well, I think that's a great message for people to listen to and take away, that there isn't effectively a shortcut as yet, because we all love shortcuts.
But that shortcut will not have that long effect.
Exactly. Yeah. So, and I think that's a beautiful message that, building the foundation is really what it's all about. And then these novel therapies have a wonderful role to play and very exciting role to play.
Exactly.
But those responses will be much more effective if your foundation is strong.
True.
So fantastic. On that note, thank you so much, Dr.
Thank you for asking me the question to highlight on it, actually.
Fantastic. It's been wonderful having you, and thank you for your insights, and thank you for taking time to spend with us and to educate us all.
Thank you very much.
Thank you.